Hello everyone, this is Dr. Ashley Etchison from the Academy of Online Radiology Education. I work at Baylor College of Medicine in Houston, Texas. This month we have curated some interesting literature in breast imaging. Before I summarize this month's articles, I would like to acknowledge and thank the senior editors for their contributions to the breast imaging blog this month. In this retrospective review study, breast imagers' follow-up recommendations for incidental liver lesions on breast MRI were compared to abdominal subspecialist radiologist opinions. The authors concluded that there is a high disagreement rate between breast imagers and abdominal radiologists when breast imagers recommend follow-up for incidental liver lesions on breast MRI. In this retrospective review study by Kim et al., the authors investigated the relationship between breast cancer kinetic heterogeneity and mean time to distant metastasis development. Preoperative breast MRIs from 276 consecutive patients were evaluated with computer-aided diagnostic software. Researchers concluded that higher values of tumor kinetic heterogeneity and peak enhancement are associated with a shorter time to the development of distant metastasis. In this retrospective review study led by Mango et al., researchers investigated the utility of artificial intelligence decision support in the interpretation of breast lesions seen on ultrasound. Approximately 900 sonographic breast lesions were reviewed. Authors concluded that ultrasound with AI improved accurate assessment of sonographic breast lesions for most physicians, in addition to reducing inter and intra-observer variability. In this retrospective review study by Dodelzahn et al., researchers compared the accuracy of microcalcification detection between 2D synthetic mammography and full-field digital mammography. The authors concluded that detection of microcalcifications on 2D synthetic mammography is not inferior to full field digital mammography. Researchers also concluded that radiologists exhibit a similar level of confidence in detecting microcalcifications with both modalities. In this retrospective study, the authors determined if intramammary edema and intratumoral necrosis on T2-weighted MRI are useful predictors of pathological complete response in breast cancer patients with triple-negative breast cancer. The authors concluded that intramammary edema and intratumoral necrosis did not correlate with pathological complete response in this specific subset of breast cancer patients. In this prospective study, the authors investigated the added value of quantified total choline in diagnosing malignancy in metastatic lymph nodes in suspicious breast lesions on multiparametric breast MRI. The authors concluded that the quantitative total choline not only differentiates benign from malignant suspicious breast lesions, but also forecasts metastatic lymph node status. In this prospective study led by Lee et al., researchers compared the diagnostic accuracy of contrast-enhanced ultrasound, MRI, and a combination of these two modalities in evaluating breast lesions of different sizes. The authors concluded that contrast-enhanced ultrasound alone has comparable sensitivity to MRI for detection of breast cancer, and these two modalities combined improved specificity and accuracy of breast cancer detection. In this retrospective study, the authors sought to determine the diagnostic accuracy of breast MRI to exclude malignancy in patients with mammographic architectural distortion. The authors concluded that malignancy is accurately excluded in patients with mammographic architectural distortion and a negative breast MRI. In this retrospective study, the authors assessed the disease burden of breast tuberculosis in 3 South African tertiary hospitals. Researchers also correlated demographic, clinical, and imaging findings in breast TB cases. Approximately 2,500 patients were retrospectively reviewed, and 62 of these patients, or 2.5%, were diagnosed with breast TB, with the most common presentation being a breast abscess. The majority of cases had a histological analysis showing necrotizing granulomatous infection. The authors concluded that a full approach to breast TB cases includes a clinical assessment, ultrasound, mammogram, and a ultrasound-guided core biopsy. In this prospective pilot study, authors sought to determine if a palpable skin marker utilized during automated breast ultrasound compromised image interpretability. The authors concluded that easily producible silicone skin markers do not decrease image interpretability during automated breast ultrasound. Thanks so much for tuning in. For more details, you can read our blog or you can find links to the original publications. Please feel free to share your thoughts and questions with us on the Breast Imaging Forum, and we'll see you next month.